Dr. Riham, please introduce yourself. Tell us about your PACES journey.
Okay, I'm Dr. Riham Mansour. I am internal medicine resident of Arab Board in Mansoura Specialized Hospital. First of all, I would like to thank you, Dr. Dai. Thank you so much. I couldn't do it without your help, really. Alhamdulillah, I did it from the first attempt. I would like to talk, Alhamdulillah. It took me about 6 months to prepare for PACES exam. So
Yes.
for the short cases, I depend mainly on the clinical course. I started preparatory course with Dr. Ramadan Zaki and advanced course with Dr. Ahmed Meher 2 months before the exam. And the mock with Dr. Ahmed Meher just 10 days before the exam. I just studied from the course material and it was more than enough to pass the short stations.
Yes.
For the long consultation station and the communication, I depend mainly on Dr. Dua course. It's really well structured and organized course. We mainly studied all the cases which came in Egypt and the previous died. I studied from the Roch pacemaker book as well for longer consultation. It gave a reasonable approach and the differential. So I advise you all to read from the Roch pacemaker along with the course. For the stations in my exam, I will start with the long consultation stations. The first consultation station for me in the exam was about lung cancer. So the complaint from outside was just fatigue and weakness. And when I entered the stations from inside, I took a detailed history approach of fatigue as we talked with Dr. Da'a. It revealed like positive B symptoms in the form of weight loss 10 kilogram in the previous 3 months, night sweats and hemoptysis on the background of a positive family history of cancer, and the patient was heavy smoker. I examined as we talk a case of fatigue. We should examine abdomen, lymph nodes, and I examined the chest as well. Examination revealed evidence of a typical history, typical examination of COPD. The examiner just asked me about the provisional diagnosis. In this station, he didn't like a list of differential. He just wanted to hear about the provisional, which was mainly bronchogenic carcinoma. And he asked me about which type of the bronchogenic carcinoma you expect. It was mainly about small cell lung cancer. He wanted to hear about the small cell lung cancer. Why this? Because it is like a rapidly progressive, causing a significant symptoms in 3 months. For the investigation for the clinical judge, the main investigation he would like to hear about bronchoscope and the biopsy to confirm a diagnosis. And the main treatment, he would like to hear about the palliative chemotherapy. For the complaint of the patient, he complained from weakness. He asked me about the differential, why the patients presented with weakness, and it could be related as a part of anemia, and he would like to hear about it could be related as a part of paraneoplastic syndrome. And I have got 26 from 28 in this station.
Excellent. Excellent, Dr. Riham. Excellent, yes.
The second, the long consultation station was acromegaly. From outside, it's rectal bleeding. And from inside, when I entered the station, I found acromegalic patient, a spot diagnosis. You have to know that acromegaly is associated with cancer colon. So for the history taking, I didn't find any alarming feature like fever, weight loss, night sweats, negative alarming feature, negative history and family history of cancer. You just seek a medical advice and diagnosed as hemorrhoids. I examined the main examination of acromegaly. I did abdomen, lymph node, and BR, which was negative. And I put a differential diagnosis. I put my first differential diagnosis as a localized cause, such as hemorrhoids, fissures. And I just told the examiner that I would like to exclude cancer colon. And for investigation, he would like to hear about colonoscope and the biopsy, plus the examination and the investigation of acromegaly. And I have got the full mark in this station.
Excellent. Yes.
For the communications, my first communication station was to discuss the DNR. It was at 82 years old female with previous history of stroke presented with heart attack. And we already discussed a similar case with Dr. Da'a in our course. We already discussed what's heart attack. I discussed with the surrogate what is heart attack, discuss about the poor prognosis of the patient condition, and discuss what's DNR and its complication and why we didn't need to do it. And I have got about 14 out of 16 as this station.
Excellent, Dr. Riham. Excellent. Yes.
The second communication station was about relapsing from outside. It was a relapsing nephrotic syndrome, and they just asked to discuss with the patient about starting prednisolone, calcium, vitamin D, and omeprazole, and we need to arrange a scheduled follow-up visit with the kidney consultant within 1 week. From inside, I discussed about what is nephrotic syndrome, And we need to, I discussed about starting prednisolone, but the surrogate told me struggling about the side effect of the steroid and ask for alternative. So my main task is to solve the problem and discuss about the steroid-sparing agent like azathioprine and the cyclophosphamide.
Yes.
For the short clinical cases, my first case regarding the chest cases was mainly COPD, and I have got the full mark of this case. The abdomen case was about CKD. They need to put a differential for a CKD in a young patients. I just told them about pyelonephritis. It could be glomerulonephritis, reflux nephropathy. I have got the full mark in the chest cases, abdominal cases. For the neurology, it was the case of multiple sclerosis. And the cardiology case was mitral stenosis, aortic stenosis, along with the peripheral signs of aortic regurg. Just one advice for the short clinical cases, because I studied from a book called Oxford Specialty Training. I studied too much to cover all the details, but I realized at the end, just months before the exams, the Dr. Ahmed Meher course was enough to make sure to pass the exam, the short clinical cases. The most important for the short clinical cases, the course, and you need to practice on daily basis. I practiced on daily basis on real cases to just to make sure that I have done the proper technique and identifying the correct physical sign to easily pass. That's all for the short clinical cases.
Excellent, Dr. Riham. Excellent. Dr. Riham, I would like to ask you about your journey in studying and practicing the LCC, because when you started with us at the beginning, actually you were like having so much knowledge until you reached to the point you have the good time management. Tell us about how did you organize your studying a lot of knowledge and at the same time having good time management.
I studied too much before I started with Dr. Dua and the Dr. Ahmed Meher course, but I realized that you didn't need to study too much to pass the exam. The most important is just to realize what they need from you to pass. You didn't need to know, to have a huge knowledge, a big knowledge. Because in the exam, they just need you to know a certain point. They ask about a specific point in investigation, in management plan. And in history, even if you know all the thing, you need to pick up the most important that you need to ask in the 7 minutes. And we have already practiced with Dr. Dua course to modify and adjust our practice in a specialized time, and it's just 7 minutes to ask about certain questions to reach the diagnosis and the provisional diagnosis and the other differential diagnosis.
Yes. So no need to be over suspicious about the history and to ask every single detail.
No.
Yes, fair enough.
Yes.
Okay, so Dr. Riham, tell us about a last advice. If someone is preparing to go for BACES exam next 3 months, how they should go?
First, the main is your course. The main source for me is in the last 10 days before the exam is the approach of longer consultation stations.
Yes.
I revised all the cases. I revised almost all the communication station along with the mock exam of Dr. Ahmed Meher. And for me, the most important station to pass the exam is the longer consultation. It's very important because it includes the 7 skills required to pass. If you got the full mark or even a good mark in these 2 stations, you can pass the exam easily.
Yes,
so
and
it's very
mainly
important.
depend on your studying, yes, and your preparation.
Prepare and practice makes everything perfect. Prepare and practice makes time perfect, makes you focused on what they need from you to pass easily. You didn't need to study too much or have too much knowledge or details. Wallahi. The course of Dr. Da is enough to pass the long consultation and the communication stations.
Okay, thank you, Dr. Riham. Thank you. Congratulations again and again for your great success. Hope you all future success, inshallah.
Thank you, Dr. Da. Thank you so much, Wallahi. Thank you.
Thank you, Dr. Riham. Thank you. Okay, Dr. Aya, are you here? Dr. Aya?
أنا هنا أيوه.